Mick Sumner led a very active life. He was a keen climber, a member of a mountain rescue team, and had a demanding job teaching in a primary school. Then one day he began to lose his energy and vitality.
I ended up in a darkened room. I was getting headaches. Just being in the lights was giving me headaches. It progressed from that to just about being able to have a shower and then make it back to my bed, and that's kind of how it started off.
The condition that afflicted Mick Sumner can strike anyone, young and old, men and women, professional athletes, and couch potatoes. ME is a chronic illness that leaves sufferers with intense lethargy, pain in the muscles and joints, mental confusion, and a host of other serious and unpleasant symptoms. It's one of the most debilitating diseases, affecting children as young as 5 and leaving many bedridden for months or even years. Its other common name, chronic fatigue syndrome, says it all. You get tired, very tired, and you don't get better. It's a life wrecker, and 400,000 people have it in Britain alone.
It was weird to have depression at the age of 10, but a lot of people say it does come with the ME, but I got very depressed when you could see your friends playing, and at the age of 10 you couldn't go out on your bike and play with them, and you just had to stay in. You were just too tired.
Well, basically my life just stopped, really, because the first 6 months I was pretty much in bed the whole time, and I couldn't really walk too well. I was really dizzy and disorientated. I mean, I remember the first time I walked down to the doctors, I was actually it was only like half a mile from the house, and I was sort of cannoning along the street like I was drunk.
But then I got to the stage that not only was I very tired, but I couldn't coordinate myself. And I used to sometimes get up in the morning, and by the time I'd had my shower, then I'd be too tired to even put clothes on. So I would go back to bed.
ME has been called the black hole of medicine because many have tried to find a cure and many have failed. Now the osteopath Raymond Perrin may have the answer, and it all started with a cyclist.
16 years ago, a cyclist came in to my practice in Manchester, and he was suffering from low back pain and also had a restricted upper back. But he also mentioned to me that he was suffering from ME, chronic fatigue syndrome. I told him in those days I didn't think I could help that condition. I could help his back as an osteopath, but I couldn't help his other condition because we believed it was very much in the mind, psychosomatic disorder that tendon having care and smile at the patient and they'll be all right. And that's what I was taught in those days. And I started treating his back, and within a few weeks his symptoms of his chronic fatigue syndrome were improving. And within a few months he was symptom-free. And he said, "You've cured me." And I said, "Well, no, I don't think I've done that. I don't know how. You're better, it must be a coincidence." So he said, no, you've absolutely, I've been ill for 7 years and I'm better. And he went back cycling and has been better ever since. What we believe is happening is that there's a build-up of poisons in the spine and the brain. There is a drainage system that many people don't know about, and this drainage system is from the fluid around the brain and the spine that goes out through the lymphatic system. And this lymphatic system helps the body cope with a lot of the toxins, a lot of the poisons. But it's the fluid around the brain and the spine, known as the cerebrospinal fluid, that is heavily poisoned with chronic fatigue syndrome. And these poisons need to drain away. And the spine is one of the areas it drains, and another area it drains is in the skull, primarily above the nose in a bone called the cribriform plate, which is a bony plate with lots of perforations, which allows lots of different blood vessels and nerves to go through, but also allows some fluid to drain into the lymphatic system. And once it's in the lymphatic system, once the drainage is occurring, then that takes the poisons away. With chronic fatigue syndrome, this is not occurring properly. This is what we found. So there's a drainage problem in the head and a drainage problem in the spine. If you have both of those together, then it leads to a build-up of poisons within the central nervous system. And this then leads to chronic fatigue syndrome.
The core of Raymond Perrin's treatment is getting the lymphatic system to work properly again. Massage can stimulate the drainage system to remove the toxins from the body.
Well, what we basically do is improve the drainage of poisons from the brain and the spine by massage techniques, by gentle manipulation of the spine, by gentle articulation techniques, and by lymphatic drainage techniques. We improve the lymphatic drainage, we improve the fluid movement within the spinal cord and the brain, and that drains off the toxins from the brain, and that starts improving the symptoms.
Raymond Perrin refined the massage techniques and began to teach them to other osteopaths. Passing on his skills would be vital because word was getting around. Shirley Bailey was looking forward to an active retirement when ME struck, and she found out very quickly that her doctors were not able to help.
Well, it was probably 10 years ago now, and I was unfortunately approaching the age of 60, and I just really put it down to advanced years, I suppose. But then I got to the stage that not only was I very tired, but I couldn't coordinate myself, and I used to sometimes get up in the morning, and by the time I'd had my shower, then I'd be too tired to even put clothes on, so I would go back to bed. And this went on probably on and off for about 6 months, and obviously it was causing distraction to my husband and, you know, obviously myself, so I went to the doctors, and the first thing he said to me when I walked in was, "Well, you look very well to me," because I'm one of these, I always have my face on no matter what. So I explained to him, and he said, "Oh, well," he said, "I think probably it's after effects of, have you had the flu?" And they could never pinpoint to what I had. And I used to come down the stairs, and then there was a point when I couldn't do any more, so I would try and go up the stairs. And I don't know if you've noticed downstairs, but they're very easy tread stairs. But my energy would only take me, and there's a little chair on the corner there, and I used to just rest on that chair till I had enough energy to do the next flight. And that was daily. It wasn't just something that happened.
Shirley Bailey was about to find her way to Raymond Perrin.
I was sitting in one evening, the phone rang, and it was my brother-in-law, and he said, "Are you watching the television?" And I said, "No, Derek, I can't watch television." And he said, "Put it on now." He said, "There's something on about ME." So I turned the television on, and there was Raymond Perrin. And I looked at him, and I thought, well, quite honestly, you get to the stage, I would have gone to a vet. I mean, I was so desperate to get well. And I listened to this gentleman, and we tracked him down. And I made an appointment to see him in the January. And when I walked in, he was quite sort of direct. And in fact, I'll be perfectly honest, I burst into tears because I thought, oh, he's going to say there's nothing wrong with me, because he was quite straightforward with everything. And he just handed me a box of tissues. He said, "That's what they're there for. Now just relax." And we started talking. And then he examined me, and he said that he put a ratio on his patients between 1 and 10. He said, "You are just 4. So he said, "You've got a long way to go," but he said, "You've definitely got ME." So I came home, and obviously I had somebody driving me, and I just felt so relieved that somebody had put a tag to me. I knew what was wrong with me, and that was my begin. It was like walking up a hill. It took a long time, but I've got through it, and I feel absolutely super now, and I can cope with life.
It took a while. Raymond Perrin doesn't offer miracle cures, only hard work and effort. But Shirley Bailey is now back to normal and enjoying the retirement she promised herself. ME affects people from all ages and strata of society. But one of the greatest tragedies is that it strikes at the young and active. Hannah Burke was only 10 years old when she contracted ME. And at first, her doctors thought they knew what the matter was.
Referred me to the hospital because they thought it was leukemia to begin with, and then they took more blood tests and that showed me ME. And then from there, they actually said there is no cure. They just said you've just got to wait for time, and we knew something had to be done. So my sister wrote to the Manchester Evening News and said she'd like for everyone in Swinton to send me a get well card, and so they did. And one girl wrote and told me she'd had it, and she knew someone to get in touch with, and so that's when we got in touch with Raymond.
We thought we'd give it a try because we'd come to the end of the road really, and we couldn't see her suffer anymore. So we got in touch with Raymond, and he said bring her to the surgery and he could see what he could do with her.
When I walked in, I was scared to death because I thought he was going to use needles, and I was scared of needles, and I'd had so many blood tests. I thought, here we go again. But it was fine, and he sat me down, and he had this scoring board test where he'd do it from 1 to 10 to see how severe it was. And so he touched different parts of the body where he could pinpoint where the ME was. And I think I was about a 3. It was severe, he said. So, and then from there he just said he had a word with Mum and Dad and said he's going to help us. So he did.
Went to the surgery. It was very nice. He did some tests on Hannah, and he said, yes, it's ME. And he said a grade from 1 to 10. I think it was 3 at the time. And he said it will take a few years. She's not going to get well overnight, but I will get her 90%, 95% better. And we were saying, would she be able to go back to school? And he said, I can't see a reason why not. So that gave us hope, really. We used to say to Hannah, when she used to say to us, Mum, when will I be well again? I used to say, think of the 3 Ps, Hannah. And she used to say, what are those, Mum? And I used to say, prayer, Perrin and patience.
Their hope wasn't misplaced. It took about 2 years, but Hannah has got her life back. She was able to go back to school, and now she has 14 GCSEs and is off to university. Perrin knew his treatment worked, but what he needed was objective scientific proof. He approached Professor Jack Edwards at Salford University to see if they could find the experimental support he needed to put his treatment on a firm medical basis.
I said to him, if you're going to try and convince the medical fraternity at large and scientific personnel, then this project really needs to be carried out using acknowledged scientific methods. It's no good for patients just to say that it was benefiting them and to show you how it was benefiting them. One needs objective measures of the patient's symptoms to show by how much and by what degree any improvement has been achieved. And also, you need hard numbers from this research and from these measurements, which will actually show that they are improving by a sufficient amount compared with, say, another group of patients who weren't having the treatments, what we call setting up a control group. And he accepted all this, and so then we, in 1994, set about starting off the project. I suggested that at that stage, it might be taking on too much for him to discover the main cause of the disease, which is what he felt he was capable of doing and wanted to do. I suggested, first of all, let's convince the medical profession that his treatment is actually working.
The research was so successful that Perrin, Edwards and their collaborators secured publication in the prestigious Journal of Medical Engineering and Technology. They had the evidence to engage the attention of leading ME researchers like Dr. Andy Wright.
I believe it's a chronic infection, and I believe it's a bacterial illness, and that the toxins are derived from the bacteria. Because it's a chronic infection, the activity in the body is centred around the lymphatic system often, and therefore anything which helps the lymph work properly is of benefit to many patients. I know Ray's work very well, and I've discussed this extensively with him, and simply by helping the lymphatic system flow properly, you clear toxins, and you also clear inflammatory chemicals that the immune system produces when there is an infection. And simply by aiding this, by detoxifying the body, people often feel a lot better. So I think really it all fits together very nicely.
The evidence began to accumulate. As Raymond Perrin saw more and more patients, he was able to start to isolate the key diagnostic factors that told him the condition was ME.
In the 16 years that I've been working on chronic fatigue syndrome now, I have discovered a physical phenomenon within all chronic fatigue patients. And there are certain physical signs that are common to all the patients I have seen in all these 16 years. And if the patients have these common signs, and they're very specific, then I will diagnose chronic fatigue syndrome. So there's a definite way of diagnosing it physically.
Once he was sure that he could diagnose ME reliably, Raymond Perrin was encouraged to use other osteopathic techniques to treat sufferers. Cranial massage, a gentle manipulation of the skull, is proving particularly useful. And stimulating blood flow in the shoulders by the alternate application of cold and heat encourages the lymphatic system to drain away the toxins that cause ME. The action of warming and cooling the affected region cause the blood vessels to dilate and contract. This produces a pump action which stimulates the flow of blood, accelerating the natural inflammatory process and promoting faster repair of damaged tissue. As Perrin refined his approach, he devised a set of massages that ME sufferers could perform on themselves or with the help of a relative, friend or carer. A gentle dragging motion up and down the nose aids drainage, as does cranial self-massage. And working the fingers up the chest speeds up drainage. Rotating the upper body around the waist stimulates the lymphatic system, as does rotating the shoulders. Marching on the spot and swinging the opposite arm helps significantly. It's also important to avoid stimulants such as coffee and alcohol. It's vital to watch out for bad posture. Here the back is bent sharply, constricting the thorax and preventing efficient lymphatic flow. Here's how it should be. Similarly, how you lie in bed can have a dramatic effect on your health. Keeping the spine straight is key. A pillow of the right thickness keeps everything in line. And a pillow between the knees stops the spine twisting and distorting. Proper sleep is another indispensable ingredient in the Perrin cocktail for beating ME. Although once you're cured, then there are no barriers to leading a normal life with all the ingredients of fun and pleasure we expect.
Hello.
Andrea Foster was another young woman who was suffering terribly. ME cost her dear, nowhere more so than in her personal life.
I lost my job. I couldn't go out. I couldn't drive. I was in bed nearly 24 hours a day. The only time I went out was with my mum and dad to the hospital or the doctors. It just ruined everything, really. I was only 19. I lost some of my friends. Most of them were really good, some weren't. It was just devastating, really, for the family as well.
She just started being very tired and no energy and, just wanted to stay in bed. And we ended up going to the doctor. He said it was a virus, and it just went on. After about 3 months, she really wasn't getting any better. So we went to see a specialist at Murrayfield, and he confirmed that it was chronic fatigue.
And I'm from my specialist, who just said, take some Prozac, go home and go back to work. Which I did take them, but I didn't go back to work. And then it just gradually got worse and worse.
And then she was just basically bedridden for a long time. And then Dennis saw a programme on television,
That's right,
Report, and it was Raymond Perrin some little girl who had ME, and she was in a wheelchair, and she was getting better. And Dennis phoned up, got his phone number, and we went from there, really. And he confirmed that she had chronic fatigue, and she was like 3 out of 10, so she was really very, very bad, you know.
I've known her since I was 18, like 11 years ago. And she was always, you know, outgoing, she was always out, she worked, she drove, she was dead independent. So when she was sick, it was like she was never out, and she was in bed a lot, and it got her down and stuff. It's not like she's 40, 50 years of age and she's staying in and stuff. It's like, you know, she's only a young girl. And then to see her get back to the way she was, and not overnight, but slowly increase and start driving again and going out, maybe not all the time, but, you know, she just got back to the way she was, you know, the Andrea.
She used to have, like, phone calls, long talks over the phone for hours and hours, and then we used to talk about everything, every subject, everything, and then one day she just said, can I come round to your house? Do you remember?
Yeah.
And I couldn't believe it. I was like, Andrea, I went, what? I went, you come round? You went, yeah, I want to come round to you. And I always remember that, always. I do. I always remember that. No, I do.
Andrea is now back to normal. A night on the town is no longer a thing to dread, but a treat to enjoy in between earning a living.
I'm working again now, so hopefully soon I'll be working full time, just going on holiday and enjoying myself and out with my friends. I really feel like I've got my life back now. It's just unbelievable. I never thought I'd get here.
Other patients are not as lucky as Andrea, something of great concern to Raymond Perrin.
The one thing which really annoys me and upsets me is the fact that some patients are given all the wrong advice. And with the wrong advice, they get worse and worse. And often they're told to push and push and push themselves and be too active, and then they get worse and eventually end up bedridden. And I believe that you can, if you catch the chronic fatigue syndrome early enough, you can prevent the very serious side that we see, where patients are sometimes bedridden for years in darkened rooms, and they can't cope with the outside world at all.
Nick Mills experienced exactly this long slide into the depths of ME. He'd been a professional tennis coach. But as the illness took hold, he found himself dramatically short of energy. He tried a variety of treatments, but eventually found himself in Raymond Perrin's consulting room. What he was promised was as far away from a miracle cure as can be imagined.
When we started the treatment, it started off, it's very difficult because the first part of the treatment is where he's getting rid of all the sort of toxins in your body, and you just feel awful. You feel just really sick and dizzy and just no energy. And I felt like that for 3 or 4 months. But all the time I was just trying to think that, you know, Raymond's got people better before.
It took over a year, but gradually Nick began to get his energy back and discovered a new passion.
Since then I've joined a running club. I've run 3 half marathons now. Like last year I ran 30 races. So I love it, and it's just such a pleasure and a joy to just be able to go out and and because I live in a New Forest, just to go out and run in the forest and just not have to worry about whether I'm going to collapse or if I'm going to spend the next 3 weeks in bed because I've overdone it. I still have to be fairly watchful for doing too much, but I've got a much better awareness of what my body can handle now.
Nick Mills had joined the growing band of ME sufferers who'd given up hope until they met Raymond Perrin. Their experiences would be enough to prove to most people that the Perrin method works. But not for Raymond himself. He's after bigger and better scientific proof, an approach that Dr. Andy Wright agrees is vital.
For the future, what I want to do personally is get more research, because it's only really good hard evidence that will persuade everybody. I think that research into any technique that seems to be helping is very important, be it medical research, and my own particular interest is to look at the bacteriology of the illness, albeit in a technique such as Ray's technique. And just because it's slightly out of the box in a sense and not conventional doesn't mean it's not of value. I mean, I believe that Ray's approach is such that it has addressed a problem, that is the lymph and detoxification, that no other technique up to now has adequately addressed. And I have seen enough patients get well from it to believe that research into this is going to be very important.
And equally important is making sure that everyone knows about this groundbreaking research.
It's my goal to get the message across to the medical profession, to other people involved in chronic fatigue syndrome, and to the patients that there is hope and there is life after chronic fatigue as well. You don't have to have it for the rest of your life.
Couldn't have done this a few years ago.